Welcome back to the Chatty Vets Pod. I'm Brendan.
And I'm Charlotte. Thank you for tuning in.
Welcome to our third podcast of April, our next 2-week Takedown episode.
Yeah, this is where we aim to bring you up to date with all the latest news and products in the UK from the last few weeks.
We hope you enjoyed our survival guide bonus episode last week. Fingers crossed it was useful for those of you who are either very new to general practice or are still studying and have anxiety about your first jobs.
Yeah, absolutely. We've all been there and done it. You're not alone. So especially if you are having that sort of pre-job anxiety, we've all been there. We're with you. And we're here to discuss all those tricky things with you. And if you do still have any questions or topics in particular you'd like us to cover that we potentially didn't cover in the last episode, or you've got any questions since we've released the episode, then please do get back in touch. Remember, you can contact us now on that WhatsApp number. So have a look at our socials to be able to get that, and send us a voice note or drop us a message. We'd love to hear from you. But moving on to today, we've got quite an exciting episode, haven't we, Brendan?
Yes, we're covering loads today, as usual, from Giardia and the canine microbiome to the thorny issue of raw feeding to get everyone's pulses racing. We're going to go a bit about the Brachy debate, and we've got another special guest on the show. Keep listening to hear us chat to Jonathan Frost. But before we get started, we wanted to do a quick little hot topic roundup on all that's new in the UK vet industry.
Yeah, so there was a few topics that you'd mentioned that I think are really good to bring up here. The first one, I guess, is really sad. Anybody that's into exotics will have known about this already, but Great Western is closing. Yeah, Great Western Exotics is closing, and I think that's so sad.
It's extra sad for anyone who works for vets now out of hours because, you know, whenever you have an exotics in there, you're one that you can phone and get.
Oh my God,
yeah. Have you ever done that?
All
and you get the best
time.
advice?
Yeah, all the time. I'd call them and be like, what the hell do I do with this? So yeah, they were brilliant. So good. Yeah.
Can I do my exotic nightmare?
Yes,
or have you got one as well?
Probably, yeah, go for it.
Shall I do my one?
Yeah.
My one was a tortoise with the whole penis was just hanging out of this tortoise, and it had been for hours. I mean, have you ever had that?
No, I mean, I don't really see many tortoises. So the only one of the times that I called them that I was panicking was I was doing a vet now shift, and I had a snake coming down to me that was bleeding from its mouth, and it was a python. And I can just about deal with reptiles, but snakes, I struggle to touch them. Like, it's just I have a bit of a fear, which is probably irrational, I know. But when I got them on the phone, they were like, it's really easy. Just have a look at its mouth. And I was like, how? And they said, oh, well, hold a credit card, get it to try and bite the credit card, then turn it on its side so that you can have his mouth open and have it. And I was like, you honestly want me to bait this snake to try and bite me?
God.
I was like, are you joking? But no, they are very good, but it's just a whole nother world that I am just not in. But yeah, moving on from Great Western, the other thing you wanted to mention, you said about greyhound racing, didn't you?
Yeah. Do you know, I've been a bit slow on this because we're quite everyone's into animal welfare, aren't they? But we try and buy good quality meat and good livestock rearing. And for our pets, we try and get pet food that's got good ethics behind the welfare of the livestock. However, I'd completely kind of not been aware of the ethics around greyhound racing. I suppose I've just not really thought about it very much. But I noticed that Scotland are banning greyhound racing and Wales are going to follow soon. And there's very few countries where it's actually legal.
Yeah.
So, and apparently it's to do with the welfare in that there's a lot of deaths at track. I think the statistic I saw was 123 deaths at the track in 2024. So it's partly the welfare in that. I suppose there's also the welfare surrounding retired greyhounds and maybe the industry for producing greyhounds. I don't know. So, yeah.
Yeah, I think in terms of greyhound racing, it's not necessarily so much about the race itself. It's about their welfare conditions and how they're kept and all that sort of stuff, isn't it? Like, I don't know loads about it, but I know they try and roll them up before the race and things like that. So I don't think it's particularly nice, but I've never been interested in it in terms of going or wanting to watch it. So yeah, I probably should know more about it like you, but yeah, I think it is a good thing that it's being moved to be banned. So I think that's a really good thing.
But do you know what, though? I think there's a whole bunch of people who are going to go, it can be done really well. The only reason I say that is I've got I know some whippet people who do whippet racing, and they show me videos, and you see all the whippets running just in a grassy field, and they all sprint across, and they're all having a lovely time. So you can see it can be done really well.
Yeah.
I suppose we're greyhound racing has become so professionalized,
Yeah.
maybe there's some people that don't have the best interests of the
Yeah.
greyhounds, and probably a bunch of people who do
Well, you think
take a lot of
it's like,
care, you know?
if a lurcher or a greyhound or a whippet, whatever, let them loose in a field, let them run, loving life. They're doing what they do best. And in theory, I think that racing is allowing them to do that. But I think it's everything around the industry, isn't it? That's the thing. It's not done with the animal in mind. It's done for the entertainment, isn't it? It's like all the controversy around the Grand National with horses. Horses love to run, they love to jump, but it's not always done in the right way. We won't go into that. But
That's a biggie.
I mean, I know where I stand on it, and everybody has their own opinion. But I think if there's a massive movement to ban it, there's obviously enough that's going wrong with the industry to say that it's probably not the right thing to be keep going.
Yeah, and then I was saying to you about how so many of my clients now, instead of getting an animal health certificate, they're going abroad, and they're usually going to France every year, and then they're just getting a French passport or a Swiss
Yeah,
passport and using that to and fro without needing the AHC.
yeah.
But I think, yeah, you had a bit of news about this.
Yeah, so obviously we were all so annoyed when we left the EU and we ended up getting rid of pet passports. So everyone had to do AHCs, and it's a pain in the arse, and clients hate it and it's really expensive, blah blah blah. So a lot of people that were regularly traveling to France or wherever were trying to get a French passport for their pets, or whatever sort of European passport, so they can keep traveling back and forth. But it then means you have to keep going back to that country to get the rabies vaccines, to get everything to keep you up to date and compliant with the passport, right? But big news, apparently, I think most people will know this now, but apparently pet passports are supposed to be coming back this year. Fingers crossed. So the government have issued a statement saying that they should be coming back in 2026. We don't know when, but they should be. So fingers crossed, we can all get rid of AHCs and start going back to passports, which will make life so much easier.
That is, I've not heard of that at all, actually. So I don't know. There might be a few people like me.
Yeah.
But anyway, moving away from news, everyone seemed to move from smoking to vaping. So you've got this now. Look, I don't know. Tell me about your this vaping thing and dogs. I don't know.
Well, I've always thought for a while, right? We know that kids, people can have this sort of inherent inhalation or whatever of smoke. So when people were smoking, we know that, and there's studies out there in human literature that show that families that smoke, their children, their pets, etc., have had lots of exposure to tobacco, to cigarettes, blah blah blah. So I was like, well, surely there must be some sort of something going on with vaping, right? Because there's still the smoke. I know it's not the same thing as smoking, but I've always thought if you're vaping, and people tend to vape a lot in the house, don't they? Because they don't get that horrible like tobacco staining on the walls and stuff. So a lot of people do it at home. And I was thinking, I wonder how this harms our pets. And actually, there was a study, it was released I think it was in JSAP in January this year. And they were looking at e-cigarettes and exposure to dogs in terms of short term. And they found that a lot of dogs that are exposed to e-cigarettes can show side effects. And I mean, this is only short term. So they're saying some dogs, I think obviously it's with high levels of exposure. And it might be if they're like chomping down on one of the little bottles or refill bottles or something, if they get hold of it, as well as sort of being exposed to it in general. But they're talking about some dogs having emesis because of it, some dogs hypersalivating, tachycardia can be quite common, but they do still say that 50% of dogs that are exposed to it are asymptomatic. So they did have a little look at nicotine toxicosis as the big effect. So I think they're obviously talking about dogs getting hold of the bottles rather than the inhalation and the vapor most of the time. But I think basically the study has said there are definitely side effects that we can see short term. So it's kind of a little bit scary to be thinking it's not been going on for that long. So we still don't really know what the long-term effects are for our pets. So it would just be really interesting to say, watch this space. And I think there's going to be more and more studies that come out to say, are these dogs, are these cats that are exposed to sort of chronic vapors at home, are they going to be showing some side effects long term?
Yeah. Well, do you know, in terms of the environmental thing, this is creeping into my consults now, but I think it's because I'm a bit obsessed by diet. But I read about a study in Scottish Terriers, where they had 3 fresh veg portions a week. God only knows where this. I need to find out where this study and the details were. Why it's Scottish Terriers as well. But anyway, they had a decent number of them, and they had a decent number that didn't have 3 veg meals a week. And the ones which had 3 veg meals a week had lower rates of bladder cancer. And I thought that was, and it was a goodish study. I mean, people come back to us and on the comments and things and tell me if they're aware of this, know the background, because I think it's kind of interesting.
Yeah.
But I mean, it's something really nice to be aware of,
Yeah.
that kind of unprocessed, cooked or raw veg 3 times a week is good for health, and surely that shouldn't be a
But I
surprise.
do wonder whether that's less to do with the nutritional content of the vegetables and more to do with the lower acidity. Because if you think the majority of meat is highly acidic, right? So if they're having a
Well, that's a
really,
bit technical.
do you know what I mean?
I
It's,
didn't know that. So
is that,
protein meal causes
am
a
I right in saying
no,
that?
no. You get an alkaline tide after a meal, don't
But
you?
I do wonder whether,
Well, that's a bit technical.
because
Well,
when you think like
yeah.
for crystalluria, etc., like your bladder pH makes such a massive difference. So I wonder if it's to do with the acidity.
Well, I like what you're saying, because the other part of my boring harping onto clients conversation is dogs are omnivores.
Yeah.
And dogs are omnivores. And I say to them, look, you have to look at how they behave.
Yeah.
They go scavenging this and that. They'll eat anything, plant, mineral, vegetable, whatever.
Yeah.
So because owners are obsessed that dogs are carnivores, aren't they? But we know that when you look at the metabolism of a cat versus a dog,
Mm,
cats are the true carnivores.
yeah.
They make glucose from protein, which is incredibly inefficient. So yeah, I always harp on about this, but yeah.
Yeah.
So the veg with a balance of meat and veg is
Yeah,
important.
except tell that to my colleague, because if I put any sort of veg or fruit or anything in front of her, she's like, absolutely not. No, not eating that. Honestly, she will eat around everything and
Yeah.
leave the veg. I'm like, you're like a sulking child. Honestly, she's a nightmare. Going from sort of vaping, your environmental causes, etc., to I guess you could call it a bit of a crisis we're having in the UK, but it's been a crisis that's been going on for so blooming long. We sort of don't really see it as a crisis anymore. The UK cat massive overpopulation. We're seeing rising numbers entering rescue centres year on year. And I think reading an article a little while ago, and it was basically saying that new RSPCA figures have revealed a 30% rise in cats entering their care in December alone last year, which is crazy. And you think how many cat rescue centres are already at the brink of falling apart because there's too many cats there already. And then they were seeing 30% more cats again last year. It's just absolutely mad. Like, where are they all coming from? I don't understand how it's just getting worse and worse and worse every year. It's crazy, isn't it?
Yeah, there's an awful lot of those sites where they're just breeding. Because where I'm working now, we get the cat protection bringing us in just 5, 7 a week just for
Yeah.
neutering, which they're just catching in various kind of feral communities. Or when you get the house where you have like 50 cats and they're all
Mm.
just breeding away. Or
I spoke to my sister about this a little while ago because she knows someone who has lots of animals and doesn't tend to get them neutered, doesn't tend to get them chipped, doesn't have a lot of money, lives on benefits, etc. And I was working in a charity practice near them at the time. And I said, you do realize that they're running like a £10 neutering voucher from Cats Protection at the moment. Like all of his 10 cats, if he can get them here, he can neuter all 10 of them for 100 quid. Like it's not going to cost a lot of money. And it would stop him from having the incessant issue of more and more cats that are just breeding with more and more cats and it just going in this round and exponential circle. And she was like, yeah, but you can't get them there. So what are we supposed to do? How are we supposed to combat this? Because yes, the numbers are probably rising because more people can't afford to keep their cats, so they're ending up in rescue centres, or their kittens are ending up in rescue centres. But then, how are we supposed to make an argument if we're saying, well, all the charities can run all these neutering drives and can make everything as cheap as possible? People aren't getting them there, and I'm like, well, then it's not really a veterinary problem then, is it? It becomes a problem with the people that own them, because if you're owning those animals, you should potentially at least be responsible enough to be getting them to the place where we can help. So I don't know. I mean, we get blamed all the time for saying that things are too expensive and nobody can look after their pets. But when you're offering 10 cat spays for 100 quid, I don't think that's really the vet's problems anymore. Do you know what I mean?
yeah. Well, from a crisis in the UK to a common condition we see all the time, even in those rescue animals, Giardia.
Mm.
I think it's worth a chat because I think, I don't know, I feel like they're being diagnosed all the time, and we've all got our own little ways of dealing with these cases.
Yeah. Well, when I qualified, I was always told give it a course of fenbendazole alongside metronidazole. But now I'm kind of now thinking, should we be just doing fenbendazole for a course and then adding in metronidazole if it doesn't get better? Because we're trying to be careful with our antimicrobial resistance, etc. Is everyone still just giving these a 5-day course of both? Or is everyone giving them a 5-day course of fenbendazole? And if they don't get better, they're then adding in the metronidazole. But then we know recurrence rates of Giardia are really high. So when are people using it? How do you do it?
A fenbendazole
Yeah.
panicure.
Yeah.
But I think it kind of feeds back into testing as well, because we kind of went straight into treatment there. But because testing, I've got a bit of a bee in my bonnet about the testing
Mm,
because I will mostly only treat Giardia if I have a microscopic visible Giardia cyst or Giardia on a fecal microscopy.
mm,
If I have a fecal microscopy that's negative and a Giardia PCR test that's positive, I will weigh it up because I'm not, especially if I've got a 3-day pooled sample, because we know Giardia is intermittently excreted. I will always want fecal microscopy. I always want a 3-day pooled fecal sample because we know that Giardia is intermittently excreted. So 3-day. By the way, I do my fecal sample in this. I do 3 consecutive days of poo in the same pot, bring it in full and fresh. Because don't you sometimes you'll get people bring in and they got like 2 tiny bits of poo in the pot or whatever. So if I've got my 3-day pooled sample, I want my fecal microscopy to be positive. Otherwise, I'm never certain if it's the genuine cause of the upset
mm,
because PCR is so sensitive to Giardia. And Giardia is an environmental pathogen. Dogs will have exposure to it.
mm,
So I think we have to be really careful to go, it's Giardia because the PCR is positive
mhm,
when you haven't got microscopy. I do 5 days of fenbendazole and then I'll retest a couple of days down the line after that. The retest I think IDEX say this on their literature as well, but I will just do a fecal microscopy on the retest rather than a PCR.
mm.
And then if it's still positive, then I'll do another course of fenbendazole, but I will weigh up whether to use something different as well, like metronidazole essentially.
I think that's probably what a lot more people are doing now, but I know that some people still do just do the both from the get go. So it's just really interesting, and it's the rationale behind it as well. Like I know that there's a lot of recurrence of Giardia, isn't it? It keeps coming back. There was a paper again. I think it was JSAT in January this year, and they said that they looked at quite a few dogs who had recurrent giardiasis, and they actually found that there was higher risk of recurrence in a few different breeds or animals. So they said it was obviously more likely in dogs less than 6 months old, which we know anyway. That's like a big target group for getting Giardia in the first place. Apparently, retrievers, for some reason, are much more likely to keep getting recurrent Giardia. But then they only had about 82 dogs included. So how many of them was it just lots of them were retrievers? Living in a non-wholesale environment, so if you're in kennels, makes sense. If lots of them have Giardia, you're going to keep getting recurrent infection because you're just going to keep getting infected from other dogs. But also, if you have a concurrent inflammatory enteropathy, so if you've got a dog with IBD or something like that, they're much more likely to keep getting Giardia infections. Or apparently they say here, having received a treatment other than fenbendazole, but I need to look into this a bit more in
Fascinating.
terms of whether it was given alongside a pain relief or whether it was given alongside. Actually, let me check that right now. Actually, they say down it's a bit vague in terms of when they talk about the different treatment things. So they say that all dogs received a daily dose of 50 mg per kg for a median of 5 days. 61 dogs received fenbendazole alone. 15 dogs received a combo of fenbendazole and metronidazole. But they've basically said that dogs with recurrent giardiasis were significantly more likely to have been treated with a drug other than fenbendazole compared with control dogs. But they said that the proportion of dogs receiving both fenbendazole and metronidazole was higher in the control group than in the case group. But this difference did not reach a statistical significance. So I think basically they've made that statement, but it doesn't really have any relevance to whether metronidazole is better or not better to use. So it would just be
Yeah.
really interesting to see if anybody knows of any particular studies that show that, because if we don't need to be using metronidazole, great, it's a great way to cut out another common use of antibiotics in practice. So yeah, if anybody does know about why or why not to be using it, if there's any papers out there that anyone's aware of, then please do share them, and we can chat about it on the next pod maybe. But yeah, it's just
Well,
interesting to
yeah.
note. So
I think we've already touched on the idea that metronidazole has been shown to show long-term harm to the gut microbiome. So
absolutely, yeah.
in a population of dogs with Giardia, and especially if they're puppies, if you can avoid it, all the better. Yeah.
Yeah, absolutely. And sort of on that note, one of the issues we're seeing alongside Giardia infections, and especially when we're using metronidazole, long term, we're seeing a lot of gut dysbiosis cases now, or issues with our patients' microbiomes. One thing we wanted to bring up while we were talking about this is there was actually an article in February this year in the Vet Times that was talking about potentially a massive new discovery in the canine microbiome. Now, bear with me because I briefly read it and I don't really understand much about genetics. When I did my biology degree, I tried to understand it, but didn't really do very well. And they basically say that there was loads of new research done into the gut microbiome. So they've reconstructed 5,753 metagenome assembled genomes. So they've done loads of research into different canine genomes, and they found 982 new canine specific strains, 89 novel species, and 10 novel genera, which they describe as an unprecedented discovery of novel taxa in the companion animal space. So I think they're basically saying that they now have a hell of a lot more information about what's actually going on in the canine microbiome than we ever knew before. So potentially they're saying that the species that they've now said are supposed to account for approximately 83% of the canine gut microbiome, compared with traditional mapping rates of about 25%. So I think our previous knowledge and what we use for the microbiome at the moment is apparently about 25% potentially of what is actually going on in there. And now they're saying that this study has potentially identified 83% of what we expect to be going on, which then means if this study, really has some value, potentially over the next few years, there might be a hell of a lot more research going into new probiotics, new prebiotics, new foods, new medicines, and new ways that we can treat, a half, 50% of that microbiome that we previously didn't know anything about. So I just think that's really interesting in terms of how it applies to the practice right now. Yes, clinically it's not that relevant to us right now, but potentially in the next few years, that could be really exciting to see what comes from it.
Yeah, they looked at like 500 poo samples, didn't they, from dogs in the UK, US, and
Mm,
France. And I think what could follow on from that, I'm hoping, but I think this was, I don't know if this was Mars or not, but what they could also do, once we know the microbiome from these dogs in modern Western dog foods mostly, I suppose. Be really interesting to see how that differs from, let's say, a dog being brought living in a completely different country with home cooked food or raw food or whatever, or from the Philippines or from Madagascar or something like that. And we
yeah,
start to see, is there different health connections? Do they have lower allergy rates? We know allergy rates, atopic dermatitis has increased. Well, it feels like it may well have increased. Food allergies and
mm,
gut problems seem really prevalent. Can we compare different populations of dogs? Because it might give us more evidence on what's a good diet. Because I always
yeah,
feel like the biggest criteria for what the microbiome is, especially the gut microbiome, is what we feed. So I think that's going to
mm,
influence pet diet as well quite a bit. And this feeds
yeah,
into what we feed dogs and the microbiome. I think 20-30% of the dog owners I see are feeding raw or have
yeah,
fed raw. I think it's huge. I personally think we need to change the way we handle these. But yeah, did you see this in the
yeah.
news as well?
Yeah, I mean, in terms of my feeling about raw foods, like I'm not one of those people that's 100% against it. I think that if you really educated yourself about it and got a veterinary nutritionist involved and said, okay, exactly how should I be feeding and what should I be feeding and in what quantities to give you a really balanced diet, then yes, in theory, it is more like a more natural diet for those dogs or cats, if you like. But the arguments I have with that is that a lot of people that raw feed don't do it as a nutritionally balanced meal. So if it's not nutritionally balanced, it's not the right thing to be feeding. A lot of people aren't that careful with the hygiene. And then when people are like, oh, well, when they were wolves, they fed this much. And I'm like, you own a Shih Tzu. A Shih Tzu does not have the same composition as a wild dog. So that's my sort of things that I would say about it is that a lot of people are sort of feeding as if they're still wild animals, which they definitely are not anymore. Have a look at studies. I just think that it's less safe, if you want to put it that way. So I'm a little bit hesitant to just say, yeah, go for it to clients, and then them come back and their dogs have got Campylobacter or Salmonella, or they've got, nutritional deficiencies because they're not giving them a really balanced diet, or I don't know, they've got bladder cancer because they're eating too much meat. I don't know.
Not enough veg. Yeah. Yeah.
Yeah.
Well, we'll get onto this Food Standards Agency survey in a second because it was quite good. But in the preface to that, I think anything that sets us up against a client, what a client's doing, it doesn't always work. It's not always the best way to have a conversation. And you need to kind of keep the channel of communication flowing, don't you? And I think
Yeah.
if we're
Yeah.
not careful, we create a barrier between us and the client. And I don't think that
Mm.
that works. I think you haven't achieved anything then. I have a lot of sympathy with people who feed raw meat. I wouldn't do it myself, but the sympathy I have is I do have an issue with only feeding commercial kibble and nothing else at all, because that's a highly processed food. And we know that ultra processed foods are really injurious to human health. And I'm going to
Mm.
make a punt that I bet they're pretty injurious to canine and feline health too. Now, there's different
Mm.
issues between dogs and cats here. Cats, obviously being obligate carnivores, but I think it's really important to have some fresh. That's why I got excited about my Scotty thing, you see, with the fresh veg. I think it's really important to have some fresh and unprocessed portion to the diet, whether that's
Yeah.
20% or whatever. And I just feel like that feels like common sense to me. So that's where I have the sympathy with them. I really like the idea that raw meat offal diets are less processed, but I wonder if you'd get just as much benefit if they were just lightly cooked as well.
Yeah, I would be more on board with a fresh meal that's isn't ultra processed but is slightly cooked and then put in a packet, if you like. Because I think the thing that I worry about is that if people are, because a lot of people try to construct these diets themselves, right, and try not to go processed, so they try to home cook everything or just feed raw from the butchers or whatever. And I just find that, I mean, I could have put a statement out there. Every client that I have ever met that says that they tailor their dog's nutrition themselves at home is always fat. Every single one, because they don't, because they do. They don't.
You went
But
there.
it's
You
true
just
though,
went there,
because
didn't you?
yeah, because they don't
Love it.
understand how to portion control, because they don't understand how many calories are in that particular portion of food that they have made and how much that dog needs. So I think there has to be some in between that we can meet where, yes, maybe feeding just kibble isn't right for our dogs and we should be moving away from it. But actually, there shouldn't have to be the only other extreme as raw food. And there should be something that we can get to that's in the middle. Because I do think it's like with people, like, how many of us in the UK can say that we're absolutely healthy and we have a really balanced diet and we feed ourselves exactly what our gut needs. You know, not a lot of us can say that really, but we're, as people, are not that good at nutrition. So we can't really expect our clients to be that good at canine or feline nutrition. And that is why I think I've always advocated for complete diets, because you cannot get it wrong in terms of, it literally tells you how much to feed per weight of dog, and it gives them, in theory, everything they need. And yes, it being ultra processed is not ideal, but at least then in theory, you're giving them everything that they need. Whereas if people were trying to home construct it, you're not quite getting the balance right. If people are feeding raw food, then you're worried about Salmonella, Campylobacter, blah, blah, blah. There just doesn't seem to be a perfect one size fits all.
What I love is that we've talked about the microbiome and then we've got into this, and I think the two are so connected because,
Mm.
and we know those ultra processed ingredients, the microbiome is sitting there waiting for its food, and we're feeding them a whole bunch of things that they just don't understand or alien to them.
Yeah.
And we're having an altered microbiome in the gut. And I think it's really relevant. That's why I think it'd be really interesting, because what you said then is really describes canine nutrition from before we thought about the microbiome, because we just looked
Mm.
at it as nutrients. What nutrients do we need as humans or as dogs or whatever? What macronutrients, what micronutrients? But actually, it's also about what food do our microbiome need? We've only just been starting to understand the gut microbiome. Like, just this study just now is like one of the first
Yeah.
big steps where we went from understanding 25% of the microbiome to 80. So I think we've been missing a big part of the story about how to feed our pets. So that's why
Mm.
I've got that open-minded thing. And also I think that it's been stronger and stronger evidence that ultra processed food is really bad. Now, can we include dry kibble in ultra processed food? I suspect you could, because it looks pretty ultra processed to me. I think it must vary a little bit.
Mm.
But going back to the Food Standards Agency survey, it was basically saying we're seeing more salmonella in humans because we're feeding more raw meat diet, and that a third of raw food diets have bacteria that are basically disease causing in humans. Which I'm assuming is your Campylobacters and your Salmonellas. I guess they're
Yeah,
the
yeah,
top two. Maybe there's others. I think
yeah,
they said that something like 8% of the packaging was leaky, and all the bugs were going into obviously beyond the package. When I talk to clients, I just touch on it really gently. I don't know, mate. I'm soft. I know people always criticize me for that, but I say something along the lines of it kind of depends on your household. If you're like 3 generations of people in one flat and you got toddlers crawling around everywhere and 4 dogs, probably don't feed them all raw food. But, if you've got a
yeah,
separate fridge in your utility room where you feed the dog, maybe you can do it well, but just,
yeah.
have your mind on hygiene.
Yeah, my thing is if they've got kids that are crawling around the house, not only have they got to worry about where they fed it and cleaning that up, I think that's where people worry and they think they've done that bit really well, but they don't really seem to think about the fact that this dog has now got all that bacteria in its mouth, in its saliva, and then it goes and licks their kid or, cleans up the floor or their high chair or whatever.
Yeah.
Or, even when they're passing feces, even when they're cleaning up poo, how much more exposure to these horrible bacteria are we worried about? You just need to be so careful, is what I would say. But
I don't recommend it,
anyway,
but
yeah,
I would be really worried about it, so that I
yeah.
kind of get across the message of that.
Okay, so that's probably enough about guts and the microbiome. So let's move on to something which I find probably equally a little bit as gross, but very important and that we see every day. So we're very excited to say that we have another special guest on the show. We interviewed Jonathan from Frost Dentistry a few days ago to talk about the big things that we need to know about teeth in GP world. So we wanted to say a massive welcome. Hello to Jonathan from Frost Dentistry. So thank you very much for coming on the pod today. How are you doing?
Yeah, hi there. So thank you so much for inviting me on. This is quite an exciting thing. So I'm thrilled to be here to share my passion for dentistry, which I love veterinary dentistry. And when you speak to most veterinary dentists, we're a very passionate bunch about our subject. And I think it annoys our partners because that's all we ever talk about. But I appreciate that the general practice primary care vets, some love dentistry, and some the dental room is the worst place they can be, and they
Yeah.
detest. So I'm thrilled to talk about my favorite subject.
Yeah. Do you know, it's the one area that I think no vet would say they're happy with their dentistry, would they? Do you think? I think in general
No.
practice, most of us, we all want to be better. I think
Yeah.
I don't know, there's something about it that's so varied, complex. I don't know. Like, yeah.
It's from my point of view, I think it's and I've really thought about this quite a lot, and I think it's a big combination of factors. Your education at university for dentistry was probably very, very similar to mine, in that I think we got 3 hours of lectures and a half-hour practical in
Yeah.
third year, and then you're told, "Oh, okay, off you go," and then you'll learn it on EMS placements, or you'll learn it when you graduate as a new grad vet, and then you go into practice and without the knowledge, without the skill set, and you're just thrown into the dental room, and you might, if you're lucky, you'll have a more experienced vet at the practice showing you or teaching you what to do. But then their education was often very similar, and they were taught something. So it's kind of sometimes misinformation just getting passed down the line. And then these procedures end up taking a very long time. They're very stressful. They're very fiddly. And often they're booked in kind of middle of the day. So you've done your morning consults, you've done a couple of spays, say, and then you're in the dental room, and suddenly that procedure that was meant to be half an hour long is 3 hours long. You've missed your
Is
lunch break. You're
yeah,
running late to your consults,
yeah.
and you hate it.
It's like
Um,
it's like the sight hounds that get booked in for a scale and polish, and you're like, really? It's not going to be a
No.
scale and polish. Yeah.
and I mean, this is applicable for not just the referral dentistry, but all general practice dentistry. If it's booked in as a scale and polish, it's probably not.
Yeah.
That's not to say I had 2 cases this week that genuinely were just a scale and polish. But I mean, the problem with teeth are like icebergs. What we can see of the tooth is about 45% of the tooth. The rest is the roots, and it's hiding under the surface. You can't see what's going on there when they're awake. some animals aren't cooperative. So you're trying to look in their mouth and they're flailing around, and you go, well, we'll just book it in. Until that patient is asleep under anesthetic, you have no idea what you're getting yourself into. The the unpredictability, I think, can be frustrating sometimes with that.
Yeah,
I did
definitely.
something that really freaked out the younger vet I was working with. Can I say this? Because you know
God,
how
what?
sometimes I say something and please feel free to correct my awfulness, okay? I think you just pick up bad habits, probably. I don't know. I think it was a cat premolar, and you know they have these silly little roots that are too little. And it broke off. It wasn't ankylosed. And I was like, oh, don't worry. I just get the little, I don't know the names or anything. The burr, yeah, the burr with the wide bit. And I just go zzz, down into where the root is. I go boom, boom, two little holes. Great. That I'm guessing. Like, are you clenching your molars right there?
A little bit. So, I mean, atomizing the roots like that, I would say, is probably a bit of a no-no. Because you're never going to get all the root. You're always going to leave some fragments and stuff like
Yeah.
that, which may or may not end up causing pain, causing problems.
Yeah.
But also the potentially can cause. There have been reported cases of air embolisms from the drill doing that.
Yeah.
So I would always say
Wow, from the
anytime
drill as well.
any root that you've taken an X-ray and you can't, if you can see a root, it probably should come out. And
Yeah.
it comes down to a combination of having the right equipment, having the right training and practice, and having patience, and it's atomizing the root is quick and easy, and there is a significant chance that it won't cause that patient pain or won't cause that patient
Yeah.
problems in the future. But we can't predict the future, so I would always say, if we can get it out, we should get it out. And if we can't get it out, and there have been roots that I physically cannot get out, and they are still in patients, and I've spent a long time working on those roots, and they're still there. But the key thing with that is, if we can't retrieve a root, we should obviously let the owner know that root is there. We have that obligation to the owner. And we should be reviewing that patient for X-rays in 3 to 6 months, and assessing change on the root, and offering referral. If we say, I can't get this, it's stuck, it might cause a problem in the future, referring it to either another colleague or a dentist who can try and retrieve that root.
Yeah.
And I will freely admit, not every case goes easily, and not
Yeah.
every tooth comes out well.
Yeah, I was actually going to ask you because I think in most different fields within veterinary, GP vets generally find it quite easy to find where that line is between what they can deal with in practice and what they should refer. For example, if it's not a normal subcut lump, if it's going to need like a pattern flap or something, you'd refer it to a soft tissue surgeon. But I think a lot of people still don't know where the line is with dentistry, right? Because if you see
Yeah.
a bad tooth, people just think, okay, well, I need to take it out. So what would you say in terms of talking to GP vets, where would you say is the line between what we should be dealing with in practice versus what we should be contacting people like you about?
I mean, it comes down to a number of different factors, as you can imagine. It comes down to what equipment your practice has, how much training you've had. Have you did your training at vet school and, a relatively newer qualified vet, and you haven't had a huge amount of experience with things, in which case there are some procedures that you will find harder. You're trying to extract those fiddly little roots in cats, or a big mandibular canine in a dog. They're not going to be fun and easy. And sometimes referring those is a very, very valid thing to do. Even if one of your colleagues is capable of that, they might not be available to do it, or you might have a patient who has an anesthetic that isn't particularly stable, or the owner may just request referral because they would prefer for it to be referred. So there's lots of different reasons people will refer, but then also there's a lot more we can do these days to preserve teeth rather than extracting them. And from my point of view, the best place for teeth is in the mouth. And if we can avoid extractions, if we can avoid anything too surgical, it can be a really nice thing to do for our patients. So, for example, fractured canines, rather than just extracting a broken tooth, we can perform root canal therapy, and we can treat the tooth. We can leave all that structure, all that function in the mouth, and so your patient can still pick up toys, play with things, and play with do everything, express all their normal behavior that they normally would, and keep that tooth intact, or as intact as it was before the fracture, after the fracture. So there's a lot more we can do these days that just isn't thought about as much. But I would say if you're, it comes down to skill set, really. I've seen some primary carers who have incredible skill in the dental room, and they're very, very good, very technical, very good with, fine fiddly work. And if you find that maybe that isn't you, then learning, there's a lot of CPD around, there's a lot of webinars around, there's a lot of books. I can recommend a good selection of books, but there's also practical CPD. So Central CPD, Improve International, both run some fantastic courses. And if you want to get into the more weird and wonderful end of dentistry, the ESAVs courses, which are based over in Ireland, will teach you everything from extractions and how to take your x-rays all the way up to doing root canals, mandibulectomies, maxillectomies, the whole spectrum of things. So there's a lot of very, very interesting CPD around at the moment, and I would highly recommend it. As a shameless self-promotion as well, one of the things that I and my company do is coming round to practices and kind of teaching people how to use the equipment they have, how to take x-rays with the machines they have, how to use their extraction instruments, and how to use their elevators, luxators, and how to actually do things with the equipment that they have in a setting that they're familiar with. Because you could be sent on a course and they'll say, right, this is the elevators we have, this is the x-ray machine we have, but then you go back to your practice and you don't have that, or you've got a different style, a different set of equipment, and different pressures. Learning how to use your own equipment is something that I quite enjoy teaching people how to do. So it's, if anyone ever does want to improve their skills in their own practice, feel free to drop me a message.
Great.
Can I say another thing that I do that's really useless? Just
Go for it.
whilst you're talking, that all these things are coming out of me, and I'm thinking, I need to get it off my chest. Right.
Go for
So,
it.
when you get like a bitch bay castrate or whatever, it's got retained deciduous teeth.
Yeah,
And they're funny little teeth, aren't they?
they're
And I always, I always make a big effort to get it all out. But sometimes, it doesn't all come out.
no,
And
it's true.
I think, well, I'm sure it'll be fine. So this is
So-
go on, tell me.
Deciduous teeth in dogs. So it's much, much more common we see those kind of persistent deciduous teeth in dogs compared to cats. I've seen a couple of them in cats, but it's mostly dogs, let's admit it.
Yeah.
And so, basic recap on the science behind it. We have our deciduous tooth and we have our adult tooth sitting underneath it in the jaw, waiting to grow out. And it's the same thing as when you're a kid with your milk teeth. The adult tooth's waiting underneath there, and as it grows, it causes the adult tooth stimulates the roots of the deciduous canine to start to resorb away. And then you're left with a crown with nothing holding it in, and it falls off. Same when you're a kid, you remember your tooth came out and it was almost hollow. Yeah, so that's just the roots being resorbed away and there's nothing holding it in. If they, rather than growing in underneath it, they grow in next to it, as you get with your persistent deciduous ones, where you've got your baby tooth and then your big adult canine sitting like that and that next to each other, the stimulus to resorb that root hasn't really happened because the adult tooth came in a slightly different position. So those roots, once the adult tooth's there, the deciduous roots aren't going to resorb away anymore. And then we end up with crowding problems and calculus and tartar getting stuck in all weird places, or sometimes even issues with occlusion. You've got this extra tooth that's often quite sharp, the deciduous ones, and they can cause impingement and stuff like that. So I would say anytime you're seeing both canines, both the adult and the deciduous, I would want to extract that. But I would say surgical extraction of that, including the tooth root itself, is best because, as I said, the root's not going to resorb on its own anymore.
And I
But the
found they're
baby
always
one
they're always so curvy, aren't they? Like especially the baby
They are.
canines, they're so
They're
curvy,
so
aren't they?
long and they're so
Yeah.
skinny. Some of them cut beautifully. You slide a luxator in there and it just jumps out. And sometimes you're swearing at it and it's not moving and it's this long
I'm
thing.
swearing
You're
all
like,
the
"It's
time."
just great." Yeah.
Yeah.
Yeah, no, they annoy me too.
Yeah.
I had a beautiful little puppy in on Friday. It was a 15-week-old puppy with a malocclusion. And one of the things we try and do with malocclusions is removing deciduous canines to kind of make space for the adult canines to grow in a better positions. But trying to remove deciduous canines in a kind of a 15-week-old puppy with the adult tooth sitting underneath the surface still, when you're trying not to disrupt that. You've got this long skinny root, you've got your adult tooth sitting underneath, and this tiny, tiny little 2 kilo mini Daxi puppy jaw. They're interesting ones. They're fiddly,
Yeah.
but I like fine work. Even when I was a general practice vet, well before all the dentistry stuff, I was never good at the big things. You wouldn't want me going in an abdomen. Let's put it that way.
Do you know, on the topic of things we do badly, someone gave me this instrument. I've never seen it before, to take the deciduous tooth out, and it was like 2 points with like a joined in a curve. I don't know. I'm not explaining it well. Like a U-shaped end.
I've got. That is my travel kit of all my equipment.
Oh my God.
And so somewhere in there, I've got that. I think IM3 make them, and they're designed to take out the deciduous canines. And they've got this lovely little curve on them to kind of scoop down the edge of the tooth. And it's got a sharp edge. And if used right, they can really make a lot of difference. I really rate those. I think they're a bit of a learning curve because it's just a very different instrument. It's a very weird one. But once you get used to them, they can really speed things up quite nicely.
Can I apologise to Dr. Dan, because I think I broke his, but I didn't tell the nurse that I broke. So you see, because I was trying to use it as an elevator, but I don't think you're meant to use it like that, because I bent the tip of it.
So the way that I tend to use it is I'm sliding it in like a luxator, so sliding it in and kind of cutting into that periodontal space. But then, slight rotation on it. It's not like screwdrivering it. Just a little bit rotation, just to kind of push that deciduous canine away slightly. But I would, to be honest, to make life easier for yourself with those deciduous canines, I would just go straight to a surgical extraction. So raise a mucoperiosteal flap, remove a little bit of alveolar bone, and then get your instruments in there. It seems counterintuitive that going a surgical route would be quicker, but the majority of times where I have a root tip fracture on deciduous canines is when I've tried to do it as a nice, neat, closed extraction. Whereas I find, and then you've got to worry about digging out that root and all that kind of stuff. So I think if you just jump to a surgical extraction, making sure you're leaving your permanent canine alone, it's actually, I find, quicker than to muck around digging out root tips.
I was going to ask you, in terms of sort of, if you have patients where you want to try and preserve as many of their teeth as you can, I know in an ideal world, everywhere would have dental x-rays. I think we're still a little bit further behind in terms of every general practice having it yet. But say, for example, I locum somewhere where they don't have dental x-rays. So quite often I've looked at a dog's mouth and thought, oh God, there's so much tartar. I bet there's loads of gum recession. Some of those teeth, there's furcation exposure, blah, blah, blah. But I'm not going to know until I get in there. I mean, I had one even the other day where it's anaesthetised. I've cleaned all the teeth up. And I've thought, okay, there's a lot of gum recession. There's furcation exposure. These teeth aren't looking fantastic, but some of them aren't wobbly yet. I mean, where's your line in terms of ones that you would suggest waking them up and referring to try and save teeth, or does that make sense?
Well, from a kind of a preservation point of view, I mean, I would always try and want to preserve kind of what I would class as the major teeth. So your canines, your maxillary fourth premolars, your mandibular first molars. They're kind of your big structural, long roots, massive teeth, really. And they're the teeth that your animal uses a lot. So they're the ones we want to try and save. If we're seeing furcation exposure, so if you can get your probe into that furcation, then we're looking at kind of a grade 3 to grade 4 periodontal disease. And at that point, the likelihood of saving those teeth with periodontal surgery and bone grafts and stuff like that is significantly lower. So I would say if you have furcation exposure, if the owner is super dedicated and keen to go for referral, then feel free to refer, but the likelihood is long run, that tooth probably isn't hugely savable. If we're seeing you're seeing a bit of recession, and on your x-rays, you're seeing a little bit of bone loss, kind of up to 25% bone loss, for example, then potentially those are savable teeth. And that can involve either closed root planing, so having a small instrument going into that pocket and debriding out all the crud and bits that are in there, all that inflamed periodontium, to kind of help it regenerate, or even going down the more advanced route of raising a flap, removing all that dead material, and then laying down a bone graft and a matrix to try and help regrow things. And that can work really well. The caveat to kind of trying to save teeth in that fashion, though, is you need an owner that's dedicated. You need an owner that is going to commit to brushing that dog's teeth every day. You need an owner that is going to come back in 3 months for repeat x-rays to assess how things are changing and improving. And if we're not going to get that improvement, or you're not going to get that kind of commitment, then it's likely that that tooth isn't fated to stay for long. I would always
Yeah.
want to give teeth a try, give them a chance, but sometimes that chance isn't as good as other teeth.
Do you find that you tend to have a very particular subset of clients as well? Because I think the majority of patients aren't covered on insurance for dentals, are they?
So,
A lot of insurance companies will say no, but
well, it depends on the insurance company, as I'm sure you found generally in veterinary. Some insurance companies are easier to work with than others. And some insurance companies will cover everything dentistry related. Some won't touch dentistry at all. And some will cover some things and not others. So a great example of that is fractured teeth. So a fractured tooth, we've kind of got two options. We can't just leave a broken tooth there because it's just going to get infected and abscess and cause pain. So our options are either we extract it. Once it's gone, it's gone. It's not a problem anymore. Or, as I said, if it's one of kind of our main structural teeth and we want to try and preserve it, then root canal therapy is the other option. Some insurance companies won't cover dental disease, which is just a very ill-defined thing. But they do cover trauma, and it's very unlikely to get a broken tooth that's not caused by trauma. Often that kind of thing, a lot of the root canal therapy I do is covered on insurance. It might not be, dental disease, but it is a problem, and insurance companies can be quite happy to deal with that. But I would say, as for kind of the type of client as such, I don't think there is a I don't, I've worked with clients from pretty much every demographic, ranging from, I have fabulous amounts of wealth and will spend absolutely everything and it's money is not a problem, to, this is a financial struggle. My business, we bridge the gap between primary care and tertiary referral hospitals. So I travel practice to practice, doing the cases that other vets may not want to do or may not have the skill set to do. I would say probably I am slightly cheaper than the big referral hospitals. They have, obviously the big tertiary referral hospitals, they've got some absolutely incredible dentists at them, and people I hugely respect. But they also have much bigger overheads, and I travel in my car with my kit, and I can keep the costs at a more affordable rate for owners. And I'm very much saying I'm not saying I'm undercutting referral hospitals. I said I have a huge amount of respect for the work they do, and I know that I know all the dentists at them very, very well. It's a very small community, but I do think I'm probably helping animals that may financially not be as in the same position sometimes.
thank you so much to Jonathan for coming on the show. We really, really enjoyed the interview that we had with you. And in typical us fashion, we ended up chatting for about an hour. So it's far too much to include in this episode, but it's really great content. So look forward to that in some episodes to come.
Thank you so much again to Jonathan for joining us on the show. We appreciate it. If anyone is listening and would like to be a guest on the show, share some new research they found, or discuss a particular topic that they are passionate about, please get in touch. We'd love to hear from you.
Yeah, absolutely. Back onto some other controversies and debates. Brachycephalics. We all love them and we all know they have so many issues and we see them day in, day out. But I guess the big question that we wanted to ask today is that, there's so much movement in different countries, especially to think about banning breeds and to be really careful with which breeds we're allowed to be breeding from. And I know that, Brendan, you touched on a previous episode, this new sort of scoring method for brackies. And I guess that the big discussion we wanted to have today is that, are we still on the standpoint that it's okay to keep them and it's okay to be breeding them? Or are we on the point that, maybe we should be thinking, is it cruel to be breeding them now? Do we need to be thinking about banned breeds or only breeding from particular scored dogs, or what are we doing?
I've got a controversy for you. I think, right, we look at our Persian cat and we go, Brachy, really bad, you're a horrible person. But then what about Maine Coon? They've got such bad health, I think, with their heart. How many times have I
Yeah.
had a heart murmur in a 3-year-old Maine Coon on a vaccine? And I look at the owner, I feel so sorry for like that, the stress that's going to cause them.
Yeah.
So I do, I mean, I don't want to take away from the fact that brackies it's a big deal, but I do think we need to look more broadly at the whole
Yeah,
breeding issue.
definitely. So when we think of brackies, your top hitters are going to normally be like your pugs and your French bulldogs, English bulldogs, etc. Right? All of the ones that are going to have their breeding difficulties. But then you think about cavies. So like Cavalier King Charles, they're banned from breeding in Norway now because of their syringomyelia and like all of their heart issues they could get, etc. Because we know they're so prone to all of these horrible health issues, they're banned in some countries now. And maybe we should be looking at it from a more holistic approach. And yes, brackies are not ideal by any means, but I think we're probably going to struggle to ban all of these different breeds that have loads of issues. You know, German Shepherds with their horrendous hips. That doesn't mean that maybe we shouldn't be breeding German Shepherds, but we should just be being much more careful about the way that we're breeding them. Spaniels that have elbow issues. You know, there's so many different things that could come into play. So I always wonder, and this is very controversial, you know, there used to be an owned dog register. I wonder whether there could be something that we eventually bring back in that talks about if you are looking to breed any type of dog and potentially then for someone to own it, there has to be some sort of register that says, yes, it's okay to breed, or no, it's not okay to breed. But then I don't know how we could ever implement that. And there would be all sorts of black market puppies and all sorts of stuff that come out. But there just needs to be a way that we can be a bit more careful, I think, because you know, if you're breeding from pugs with long noses, if you're breeding from ones that can go through their whole life without a BOAS surgery and are doing quite well, if you're breeding from Frenchies and you've had a line of Frenchies that aren't struggling to give birth and generally are doing really well, their pelvises are a bit bigger or whatever that might be, that we should be breeding from those dogs rather than breeding from the ones with loads of issues. But it's just, I don't know where we're going to head with it. Like, what direction is the government going to go in terms of, or the RCVS, whoever's going to make any decisions? Where are we going to go in terms of where do we go from here?
I've got another controversy for you, right? I think this idea that you do hip scores and genetic testing and and then what you're doing there, I'm not against it, don't get me wrong, but you're making the gene pool smaller and smaller and smaller. And
Yeah.
that is not
Yeah.
helping, I don't think.
Yeah.
What we need to do is make the gene pool bigger. So
Yeah.
something like if people who are licensed to breed had to do every fourth litter was an outbreed, a crossbreed,
Yeah.
to try
Yeah.
to, because we need to do something to actually to be less careful with breeding. So I do
Yeah.
think we should be concentrating on keeping the breeds, but trying to get them onto the healthier end, and maybe
Yeah.
some compulsory outbreeding to make the
Yeah.
dog population of the country overall more diverse.
Yeah, absolutely.
That's
But then
my solution. Fixed.
yeah, you imagine trying
Done.
to get the Kennel Club on board with saying that we should be outsourcing and not keeping pedigrees.
Yeah.
I think there is some uproar, but
Well,
it
every
is
fourth
probably what
litter,
we
yeah.
need.
Who has say over this? But I don't know, the
Yeah.
breed health secretaries for the different breeds, I bet you some are brilliant, especially the working breed ones.
Like with the working breeds, you're breeding them to be better at work. Therefore, you're going to be breeding them to be healthier dogs, because the more healthy they are, the better they are for their job, right? Because if you have a dog that's too flat faced and it can't breathe, it's not going to be able to go, I don't know, catch pheasant or whatever you're going to breed them to do. So I don't know what the answer is, and I don't know where it's going to start from. Is it going to start from public education, or is it going to start from the public being told what to do by the government or by, you know, veterinary people? I don't know. I don't know where it will come from, but something's got to change, isn't it?
I don't know the complexity of it. Maybe this is we need to get some people on who, yeah.
If there's anyone from the Kennel Club or anyone high up in breeding, etc., that is listening and would be interested in getting in touch, then please do, because we can sort of chat about it from a vet point of view and seeing these dogs as clinicians. But it'd be really interesting to talk to someone that's in that world and say, you know, are things moving? What direction are things moving in? So yeah, please do get in touch if that is you.
Dan O'Neill, get in touch as well if you want to come
we
on the
like
show
to think
and
he's
chat.
listening.
Yeah, I like to think he's listening.
So roundup time, we've covered loads again today, from the Brachy debate to Giardia and the canine microbiome, raw food and vaping, and the wonderful Jonathan joined us to discuss all things teeth related.
We hope as ever you've enjoyed listening, and remember to get in touch if you have any comments or suggestions to help us improve these pods for you, any topics you want particularly to cover.
Yeah, absolutely. We'd love for you to get in touch. And remember, you can get in contact with us on socials, send us a message or a voice note, please. on WhatsApp, or you can start a clinical discussion via the blog on our website. So lovely Brendan always puts up a blog after our podcast, and there's often a lot more in-depth material on there and discussion. So please click on there if you want to have a chat to us. And remember, if you're loving the pods, please share away to your friends and colleagues.
Absolutely. Please share away. But for now, thank you for listening. So next weekend is our weekend off. So we'll be enjoying a well-deserved rest. But join us on Sunday, 10th of May, where we're excited to say we've got another special episode planned for you dedicated to our amazing vet nurses.
Yeah, absolutely. So in May, it's RVN Awareness Month, and we wanted to celebrate our nurses the best way that we know how by doing a podcast dedicated to them. We, fingers crossed, are going to have a couple of really exciting guests on the show, and we will release details about that a bit nearer to the time. And any RVNs or SVNs that are listening that have any specific topics or questions that they'd like covered, please do get in touch. So also WhatsApp, and we might just feature you on the podcast.
We're looking forward to it already. Until then, it's bye from me.
And bye from me. Take care.
The content presented in the Chatty Vets podcast is intended for licensed veterinary professionals and is for informational purposes only.
Views expressed are those of the host and guests and do not substitute for clinical judgment or individualized patient care.
Drug dosages, protocols, medical advice discussed should be verified against current literature and manufacturer's guidelines.
Class and its creators are not liable for any errors, omissions, or adverse outcomes resulting from the application of this information.
Always consult relevant laws, regulations, and institutional policies in your practice. Listener discretion is advised.